Dr. Jaffe, what specific PERQUE products and amounts would benefit young children with regards to growing pains specifically?
Important question, and important to distinguish whether we're talking about growing pains, which you get during growth spurts in relation to your adequate nutrition, essential nutrition, in contrast to either a chronic infection that can affect the joints and be very similar from a child's point of view, or an autoimmune condition like arthritis. So how do you distinguish what I will call growth spurts, which are very physiologic, from chronic infections and autoimmunity? Well, the direct answer about growth spurts is that children need magnesium and choline citrate based on the morning urine pH. They need Lifeguard to keep their urine sunshine yellow. They need Joint Guard. They need ascorbate based on the C-cleanse or however you decide the ascorbate is needed. And they need Pain Guard or Repair Guard for healthier polyphenolics. Now, with regard to Joint Guard specifically, if it is a growth spurt in the joints, in the ankles, knees, hips, large joints, then 3 weeks on Joint Guard will measurably, noticeably impact the reduction in discomfort, the acceleration of type 3 collagen, which is joint-specific collagen, as opposed to type 1 collagen, the quick scar-like collagen. So if it's a growth spurt, you need to up the nutritional protection, Lifeguard to keep the urine sunshine yellow, the magnesium and choline citrate based on morning urine pH, the ascorbate based on C-cleanse, the polyphenolics, either Repair Guard or Pain Guard, and the Joint Guard, which you give for just 2 or 3 weeks and see if it makes a difference. If it does improve the comfort, the joint mobility comfort, the stretchability of the joints, then it is Teutonbankes, which is an old German term for growing pains. On the other hand, if it's a chronic infection, say Lyme or SIBO or something related to maldigestion, dysbiosis, lack of repair of the intestines, then the LRA tests and plans are needed. And what if the suspicion is that this might be JRA, juvenile rheumatoid arthritis, JRA, juvenile rheumatoid arthritis? Again, the LRA tests and plan. So if it's just growing, an extra hug and some nutrition. If it's a chronic infection or an autoimmunity, then it's a sign that the immune defense and repair system is overworked and under-functioning. And I will circulate through Melissa a short YouTube video that reinforces just what I'm saying. Growth spurts are fine. Kids go through them and are better for it. Chronic infections and autoimmunity, we need to differentiate and apply the full LRA tests and plan.